maybe 10 years old. My dad wanted to get me out of the house, just give me something to do, keep me out of trouble. I used to watch the Miami Hurricanes, Miami Dolphins on TV. So that's really where my inspiration came from. And along with that, with my dad urging me to go out every day and participate after school, that's how it all started. I say number one, my dad. Number two, my high school coach. My high school coach was a great inspiration. My father passed away when I was 13 years old, and he really stepped in and became that father figure for me. Also that inspiration for me to continue football, continue with my education. Things were very hard for me. I almost dropped out of school at one point when I was in high school because I didn't feel like I had that person there, other than my mom, who was also very supportive, who played a father and mother role for me. So having those people in my life really helped. It's funny. I always wanted to be like my dad. So my dad was in the Air Force, so I joined the Air Force ROTC when I was in high school. Reserve Officer Training Corps, and I was going to the Air Force. That was my dream. To serve the United States and to be like my dad. I just happened to become good in football. Over a period of time, and over a period of time, by the time I became a senior, Jimmy Johnson at the University of Miami came a knocking. We'd like for you to come play for us, and I said yes. Well, when I was at the University of Miami, when I became a senior, I was invited to the scouting combine in Indianapolis, where you go and you basically put on a show for all the NFL teams. The New York Jets thought I was good enough to come join them. I was also recruited by the Minnesota Vikings and the New England Patriots, but chose the New York Jets. Played a couple years. Various injuries just became too much for me. At a certain point, I thought I needed to do something else with my life. And football wasn't it. I knew football would end at some point. So what was the next plan? So, over a number of years, medicine came up. So that's when I decided to go to medical school after I retired. Well, football taught me a lot. It taught me about teamwork. It taught me about discipline. It taught me about perseverance. Pushing through the hard times. Sometimes realizing that it's okay to lose. And things can be better if you win. But always keeping that in the back of your mind that things don't always go your way. And how do you persevere and get through it? Well, again, there were people in my life that kind of swayed me and turned me in that direction. When I retired from the NFL, I was an investment banker, and I was bored. I didn't know what to really do with my life at that point, and I knew I didn't want to do that for the next 30, 40 years. By the urging of my family physician, certain family members, they said, "Have you ever thought about medical school? You may want to give that a shot," because I always had an interest in the human body and how the body worked. And I said, "Yeah, I'll give it a shot, see how it goes." And that was a defining moment for me because it really changed my life. And I always like to help people. And so I put all that together, that combination together, came up with medicine. It's kind of funny you asked that because I didn't think I was good enough. I didn't think I was good enough to go to medical school when everyone was urging me to, because at that point, I I went to medical school when I was about 30 years old. So, I was competing against students who were a lot younger than me, coming fresh out of college, who were, closer to the books, as we would say. But I decided to do it anyway. Became very competitive. It's just that competitive nature I learned from football. Was able to use that. Got into med school, and it's just changed my life. I did. I had many mentors along the way. So many I really can't pinpoint one. I did have a cardiologist named Dr. Morton Diamond who really spent time with me after hours. Whether it came with questions about life, questions about studying, questions about upcoming tests. He really mentored me and taught me a lot about life and a lot about medicine. So I used that to excel in medical school. Don't quit. One of my mentors actually told me to use a football analogy, get back on the field. During my second year of medical school, I got divorced. I had 3 kids. I was a single father. My wife at the time walked out, left me with 3 kids. So I was really contemplating, going to work full time because I had to raise my kids, and consider leaving school. So I took a year off. Was able to stay involved in school. I got a master's degree during that year off, and then I went back into medical school. I was readmitted after a brief time off to handle my personal affairs. So I always took that advice with me, and I still thank them for that today. Yes, it has actually, and this came about recently. I've been a chief medical officer for one of the largest FQACs in Florida. When I got this position here at Carolines, I was also the CMO. At the time, when Elise Sawyers was here as the CEO, that was my goal. That was one of my plans. I used to speak to her about, what's the next step for me? What's the next goal? The next obvious goal would be CEO and not a lateral move as a CMO again. So I would like to go even higher at some point, maybe on the state or federal level. But we'll see where life takes me. I grew up in a public health system. Medical care was not easy for me to attain. I really didn't have a private doctor until I was 21 years old. I grew up in the inner city of Fort Lauderdale, so I understand how difficult it is to get great quality medical care. When I went to medical school, that's one of my goals, to go back to my community and serve, and to give back, and to really fight and be an advocate for those who are underserved. So that's where my passion really comes from. My vision for Carolines is for us to continue to provide great quality care, provide great access for our patients in our community, for us to be innovative, cutting edge, and just make sure we continue to expand our services, expand our centers, make sure we're providing services for those who are disabled, those who are hearing impaired, and we want to continue doing this regardless of ability to pay.